Maryam, you're the CEO and co-founder of SDIP Innovations. Can you give me the company pitch?
So we have this technology that is next generation bioresorbable bone implants. So basically we have a platform technology that restores the bone and replaces the bone at the same time. So imagine if someone has a big gap in the bone because of a trauma, or the surgeon has created the gap actually purposely for doing some operations such as different type of osteotomies. There they have to use something extra to fill the gap. And JAZBI is that promise, so it holds the bone in place and it converts to bone. We have pre-shaped fillers, so they come in shape of cubes, wedge, and rods. And we also are developing delivery kit, which is basically a cartridge and a delivery device. The surgeon put the cartridge inside the delivery device, and then what comes out is soft for 1 to 2 minutes, so surgeon can shape it according to patient's need. And then after that is as solid as bone. So that's the technology, and future applications also like bioresorbable screws, anchors, other things that can be made using this platform technology.
Wow, so you actually don't need a removal surgery after all. Once the device, the technology is in your body, it stays there and it becomes bone.
Exactly.
Wow, and it's like saving a lot of time and a lot of pain to the patient. So that's fantastic to hear.
Exactly. And it's important because there are other products in the market, but it's important that you have something that doesn't create inflammation, removes the unnecessary need for removal surgeries, repeat surgeries. So JAZBI, so far in the studies, we've shown that it doesn't create any bad body response. So it's important to have something that holds the bone in place, converts to bone, and also doesn't create side reactions basically in the body.
So the gold standard at the moment is creating a lot of inflammation. And how did you go to circumvent this challenge?
So most of the surgeons actually use bone from another part of the patient's body. That means opening 2 sides, more time in the surgery theater and more time from surgeon. Also higher chance of infection and more painful patients. But also they get the extra bone, the bone grafts from allografts. That requires lots of cutting, shaping, again, extra time in the surgery theater. And there are also chances of disease transfer between 2 people. And then there are synthetic bone grafts. And as you mentioned, the gold standards are either brittle because they are just purely made of something called ceramic, or they cause inflammation when they have bioresorbable polylactic acid in their structure.
So the composition of JAZBI, it's specifically created to not trigger inflammation then?
Yeah, it has mainly 2 parts. One part mainly responsible for bone conversion. That's basically induce bone to regenerate more and more bony tissue, native tissue. And we also have a polymer that is more responsible for structural integrity, giving it shape so it's not brittle. Basically, surgeon can cut it, handle it easily. And then when it comes to the delivery device, using JAZBI delivery device, the promise is that surgeon can get any shape, which is mostly due to the polymer that we use in the structure. So basically, it has different components responsible for different tasks.
Different property. Perfect.
Yes.
Fantastic. And so I read on the JAZBI page that it's 30 times less expensive than the current gold standard and 5 times more cost effective than ceramic alternative to manufacture. So why is it so much more cost effective?
It's JAZBI 30 times cheaper than the gold standard because the polymer that we use is actually less expensive and it's new for medical device applications, basically.
Beautiful. So the end price for the hospital to buy and the cost for the society to pay would be less expensive.
The cost to manufacture is different from the cost that the customer will pay, right? But it saves money from health system. And also, more importantly, when it comes to JAZBI delivery device, it can save surgeons 15 to 20 minutes of time. That's huge in terms of the cost structure for hospitals and the surgeons' schedule, how they can schedule their surgeries during the day. That's a big savement.
Oh yeah, I'm sure they would be very grateful to save 20 minutes. Yeah, wow, beautiful. And so what is in the name? Why did you call it SDIP Innovation?
SDIP stands for Safe Degradable Implant Platforms. And when we name the technology, JAZBI in Farsi means something that resorbs.
Welcome to Multiple Hats, a show about STEM professionals who have gone off script and carved their own path beyond the tracks that were set for them. Science, technology, engineering, mathematics, medicine, how they found their why and what it takes to make it happen.